They numbed me up. I was a gangster in there. Cut me open, pulled the baby out. What's up, you guys? My name is Misha, but you can call me Misha for short. Thank you so much for returning to my channel. Please don't hesitate to hit the subscribe button below. When I started this weight loss journey it was a little over 4 years ago. I had this idea in my head that I was gonna lose the weight in a year. I was gonna lose 100 pounds in a year. And I thought that I would have a little bit of, loose skin because I've never been the skinny chick. I've always had a little bit of weight on me. I've always been the tall, chubby girl. But at my heaviest, I was, 318 pounds, and I stand about 5'10". So a couple of weeks ago, I posed a question on my Instagram account, and it was, would you get plastic surgery for corrective purposes, such as correcting loose skin from weight loss? But the reason why I asked that question is because for a while, I have been contemplating getting plastic surgery myself. Once I got past, I would say 60 pounds of weight lost, I started to see a little bit of the looseness in my skin, and my abdomen has always been my troublesome. More for like pregnant women. If you've had a cesarean, when you leave the hospital, they will sometimes give you these garments that will help with your abdomen, and it's compression to help support your core because you just had that core cut into. I did look into waist trainers that would help support my abdomen while I was, recovering. There's always that recovery period when you give birth. That helped. That actually helped a little bit with the elasticity in my skin, but once I started being able to work out, it wasn't as substantial. With waist training, I'm not gonna knock it because I do it from time to time, and I advocated for that for so long. But you can't just throw on a waist trainer and expect the skin to just go back. You know what I mean? There's diet and there's exercise that goes along with it that helps with snapping back. Coping with the changes of my body has been difficult, mainly because when you start this, you have this idea of, I'm gonna lose the weight and my waist is gonna go in and my arms are gonna get smaller and my chest is gonna go down and my legs are gonna get toned. And granted, you can definitely achieve those goals. So probably one of the most effective things that you can do to help with loose skin would be lifting weights. Not only does that help with the elasticity, but you're building muscle. I have seen women who have lost a lot of weight, and I've seen women that have given birth and have had this C-section. I'm trying to get like those women that got like that V. You know what I'm talking about? Like the V. If I get that, I'm not gonna know how to act. So don't let me mess around and get a V. And some abs too. It's a wrap. I've been doing a lot of research, and the doctor that I feel would benefit me the best is actually located on the East Coast, Dr. Joseph Michael, and he does everything. But the one thing that I'm super impressed by is his mommy makeovers and how he helps patients with getting their body back after losing a substantial amount of weight. I've been juggling between, should I go ahead and just do like a virtual consultation with this doctor and go for the surgery, or should I try and work a little bit more, maybe try and lose another 20 or 30 pounds and then assess where my body's at. I don't think you can do surgery, that kind of surgery, without amnesia, so I definitely have to go under. But even with my 2 kids, cesarean, they numbed me up. I was a gangster in there. Cut me open, pulled the baby out. If I do decide to do this consultation, The doctor, his name is again Dr. Joseph Michael, and I will leave his information below if you guys want to check his work out. He's located on the East Coast, so it would be a virtual consultation. Dr. Joseph Michael, he actually just opened his clinic back up. I told myself that after I reached 100 pounds lost, that my reward to myself would be to get plastic surgery done, to correct anything that at that point I felt I couldn't do by myself. I'm kind of like on the fence about if I want to go ahead and get it done, only because I'm about 10 pounds away from my goal of 100 pounds. And going into this, I thought 100 pounds would look different. And I feel like I might want to go another 20 or 30 pounds and see what that looks like. I want to do it now, or if I just want to wait a little bit longer. Especially because we are in this pandemic. Granted, his practice is opened, and there are different states that are opening up, but I've never had plastic surgery, so I don't know what the body goes through coming up out of amnesia and processing healing, you know, from having skin removal and lifts and all of that. You've worked so hard for, you know, this body that that has been in your brain, your end goal for so long, and you're getting close to the weight being completely gone, and you have this skin. Would you get plastic surgery in order to correct it, or would you just thug it out, you know? Let me know in the comment box below, and I'll let you guys know what happened. And make sure you're subscribed too, so you can follow me on this journey. You know, I'm pretty sure if I end up getting this, you're gonna want to see it. So you have to be subscribed. Subscribe, all right? Of course, if I do end up getting it, I'm gonna take you guys with me. So make sure that you are subscribed so that you can follow that journey. And yeah, as always, guys, thank you so much for your time. I appreciate you guys, and peace and blessings.